There we go.
Thank you. Josh, do we have any attendees?
Nobody yet.
Okay. All right, so we're going to begin. This is the March 14th meeting of the Policy Committee. I've put the agenda in the chat, and I'll do that one more time to make sure that people have public access. Good morning, Dr. Johnston.
Hey, Dr. Johnston.
Good morning, everyone. I apologize for being late.
No problem. So we're going to get started with two policies that we mentioned in our last meeting under the health and wellness section of our 200 level policies. And Dr. Van Voren is going to review those. That's policy 209.2 and policy 210. And Dr. Van Voren, I will bring them up while you're doing that. Okay.
Okay. So the first one, policy 210. No, we're going to do diabetes management first. Policy 209.2. We have not previously had any policy for diabetes management. It fell under the use of medications prior to this. Because of the changing needs within our student population, we felt that it would be prudent to have a policy specifically addressing those students that have diabetes and how we are going to treat it within the school system. So as soon as it comes up here, we can kind of walk through.
Dr. Van Voren, Josh, if you could just make sure that I have screen sharing rights. That'd be great.
Try now.
Okay, perfect. Thank you. All right, here we are, everybody.
All right. So it walks you through, again, separating out diabetes management from the use of medications. It separates out specifically starting with definitions, because anyone that comes in with a diagnosis needing diabetes management is either going to be treated through a management plan, an IEP, a 504 plan. So again, we have our health plan, which is run through the nurse's office, a 504 plan, which is overseen by our guidance counselors. And then we have an IEP because that's when we have another service that is being offered and it can fall under that. So walking you down through, you'll see that it says trained diabetes personnel. And it says non-licensed school employees who have successfully completed the required training. So previously when we had our policy meeting, that was where we kind of got hung up, because as you kind of walk it down, it talks about this trained diabetes personnel. And we were concerned about that, the liability of somebody that's not a trained medical professional and how that would look and how would parents feel. So what I did is I did a cross-reference of 10 other school districts in the area, and I pulled all of their policies. And barring about 5 words difference, they were exactly the same with 9 out of the 10 that I pulled, because apparently that is what regarding Pennsylvania Department of Health guidelines, along with the suggestions from PSBA, they are suggesting that very similar to our EpiPen, where we train our teachers annually, that they are in fact the non-licensed school employee, not because they're non-licensed with teaching, but because they're not a technical medical professional. So what we're going to do with this is we are going to offer very similar to how we do annual EpiPen training. We are going to be doing diabetes management training, which will walk them through, typically it's a webinar, and they walk through the signs and the symptoms when you see a child struggling, things to look for, and steps to take when you are thinking that a child is going into having any kind of low sugar episode, high, whatever it is. And then they're going to, go to the 504 plan, the IEP, or the individual health plan that is developed for those students, and work in tandem with our school nurse. So that is really what we delayed things for, because we wanted to make sure that we had everything in place to be able to offer those services and make our teachers and our support staff feel more comfortable being trained adequately to be able to support those students in the classroom. So as you go down through, you'll see that we then talk about school possession and use of diabetes medication and monitoring. Very similar to our medication policy, which we will get to. It talks about having that written request from the parents, that we can follow the doctor's orders, because anytime we have medication or a medical condition, we go by doctor's orders. It's very strict. We do not deter from those orders. So as you go down through, a written statement from the healthcare practitioner talks about all of that information. Again, very similar to those that even as we walked through last time, the EpiPen policy, very similar to that. We then go through and a nurse has to okay that the student is able to do and handle their medication. And then, we have a written acknowledgement that a student has been trained to do it, because we need that to make sure that we are solid and have that communication between the practitioner, the family, and the school nurse. So we go through here, we talk about, a student is prohibited from sharing, giving, selling, using diabetes medication in any other manner that it has been prescribed, and talks about delegation of responsibility for this policy. And then that brings us to a close. Any questions?
No.
Dr. Van Born, can I just ask you, this is more like a question that's just in my head. I'm assuming the trained personnel could change based on like who the child is with each year, correct?
Yes.
Okay.
Yes, but typically, even when we have a student that has, severe allergies that could go into anaphylactic, every year the teachers are trained, but every teacher is trained on how to use an EpiPen so that they're prepared to give it in an emergency situation, whether it's on a field trip, whether it's in the classroom. The same will be here with the training. Everybody will receive this training, because you also have your special area teachers that come in contact with this student, and not every student with diabetes is going to need instructional support staff or a paraprofessional to assist them during the day. So we want to make sure that there's a blanket training, and then there's going to be a more specified training, because when a health plan is developed, the nurse or the 504 or whatever it is, they sit down with the teacher at the beginning of the year to make sure that that teacher feels comfortable with going through the steps of that plan, should there ever be an emergency situation.
Okay, thanks for the clarification.
Sure. All right, that brings us to medications.
Okay.
So specifically with medications, we wanted to update our medication policy to adhere to the provisions of the Pennsylvania Department of Health guidance when it comes to medication and emergency care. So there was specific wording that was changed, including a definition of a licensed prescriber. And I think we saw that before. I forget which policy it was, but we had a question about who could be considered a licensed provider to write notes for students for medical information to share with the school. There's more specific language pertaining to students' self-administration of medication, because before it wasn't as specific. The administration of medication on field trips, school-sponsored activities. When you look down the delegation of responsibility, we talk about involving the nurse from beginning to end, because of course, anytime there's medication, whether it's an emergency with regard to that medication or an emergency, and then we have to report what medications and give that to the emergency personnel that come in, we want to make sure that there's a partnership there. We have guidelines for parents to talk about the regulations, and that the delivery of the medication should come into the nurse's office. In the past, it had to be that the parent brought the medication into the nurse's office. We do allow the students to bring it in, and as long as the nurse knows that it's coming, the students are allowed to transport it to school, because it was causing such an issue for some parents that work different hours and were unable to meet up with the nurse to bring it in there. Storage of medications is going to be locked up with the name of that medication, the administration, the doctor's order specifically for that within the nurse's office. It would need to have the following information, and you'll see there that it talks about very specific information comes in where it was more generalized previously. The disposal of medications has not changed. Self-administration, we had some students bringing in some medication that wasn't necessarily prescribed. And so we wanted to be able to make it more specific, that allowing them to self-administer, it should be an emergency medication, not just any medication. So that was more specific. It talked about the order that needed to come in from the licensed prescriber or doctor. We had to have parent written consent. There had to be a health plan in place, which included, if ever there was an emergency, how to handle it with that medication. But specifically before, there has to be, like when you're coming in with amoxicillin, that looks different than when you have a daily medication that has to be taken at noon. So, the nurse has to take a baseline of the student's health status, and it has to be in tandem with what the doctor's orders came in and the directions to be given. The student has to notify the nurse following each time that they self-administer medication. That can look like a call down to the nurse, a stop by, something of that nature. And then going down through, it talks about administration during field trips and school-sponsored activities, which is very similar, except that it talks about a formal agreement and using a licensed nurse to be able to prescribe that if it's not a medication that can be self-administered. And that concludes our medication policy.
So these are all the health and wellness policies. These two policies were also reviewed by our solicitor. So in addition to PSBA making their recommendations, because we've had specific instances where we had questions around self-administration and around extracurricular activities and field trips, we really wanted to make sure that these were as clean as they can be. So we feel good about putting these forward at this point. Are there any questions about these two policies?
No.
I just had a quick question about the parent who attended the last meeting who had a
Yes.
child with diabetes. Did someone connect with her and incorporate her concerns or listen to her?
Yes, so thanks for asking that. That particular parent has been in regular contact with our administrative team at the middle school, as well as our central office administrative team.
Fantastic. I figured, but I just wanted to confirm. Thank you.
No, thank you for asking. We appreciate that. Okay, all right, so we're going to move forward. And Dr. Van Born, you are welcome to stay if you like, but if you would like to move off, I know you're not involved in the rest of these policies, so you can feel free to get into the rest of your day. All right.
Thank you.
Thanks very much for all your hard work on these.
Thank you.
Bye. Have a good day.
Have a good day.
All right, so Dr. Johnson, which policy would you like me to bring up next?
I believe we are on 202, eligibility of non-resident students.
Okay, so the rest of the next section of the agenda, if you're looking at the board docs agenda, are all policies that fall under support services. And since Dr. Lutz is not joining us until mid-April, Dr. Johnston took care of reviewing these policies with our social workers and school counselors, as well as her own understanding of registration and supervision of registration at this time. So Dr. Johnston, they're all yours.
Thank you
202 is
very
up.
much. Good morning, everyone. It's nice to see you bright and early on this sunny daylight savings time Monday. So I know we're all like laser focused since it's so late in the day now. So starting with 202, some of you are new to us this year and may or may not recall that there was some attention to this particular policy during last school year and our hybrid experience. We provided some allowances to this policy for students who were moving in and out of the district and able to participate in our hybrid offerings last year, and we worked towards educational stability. So we had a policy, we revised the policy to last through only the 2021 school year, and then we revised it again. So we've poked at this policy more than most, mostly because we had just adjusted when we would allow flexibility in where you resided for the continuation of the school year. We have now realigned all of this, and the policy recommendations, as you can see on Dr. Yannicone's screens, really are very minimal. But when a senior moves out of the district, if the family is able to provide transportation, we have agreed in this policy to allow the student to then graduate from Springfield Township High School, assuming they do so late enough in the year after January 1st. That is the primary change in this particular policy. Everything else puts it back in line to where it was prior to the pandemic. Any questions for me about that? Okay.
No, thank you.
Excellent. Moving right along, Dr. Yannicka, we're going to go to policy 204, attendance.
Mhm. This one, we have lots of changes.
We do. As some of you may be aware, I know that we have a very well-educated board of educators in this particular committee. So you may know that Pennsylvania changed the requirements around school attendance a couple of years ago. And this has been a work in progress to bring us to revising this policy. We just waited until we did the full policy revision. But all of the recommendations, and the reason there's so much black text in bold text in this document is because the law changed in Pennsylvania and our actions have been changing as a result. So that law changed in 2016, just to put a framework on it, and extended mandatory attendance, compulsory attendance to school from ages 6 to 18. And that is a major change for families, but it also then specifies what school districts are obligated to do in terms of ensuring what we are using to excuse attendance. And you've seen as families some of that, where we have an attendance line to make it easier for families. Our social workers and school counselors work closely with the assistant principal and the attendance secretary at each building. We track attendance regularly. We follow up. We do school attendance improvement plans called the SAIP. Of course, there's letters, SAIP. So that is all articulated through here. And if and when students are still not improving their attendance, there are disciplinary measures, including referring the family and child to our local district court in Orland, or referring to Children and Youth Services for either diversion programs and or management by Children and Youth case manager. So all of that is articulated here. It captures all that language about what is excused or lawful. We have a process in place to request educational trips when families are going to leave the area and their child will be absent because they're going on some time away from the district. And then sort of how we need to address special education needs or those students who have disabilities in their 504 or IEP and addressing attendance. I know that was a lot. Do you have questions for me?
This policy, as Carla and Amy know, this policy regularly comes into play. So there's a lot of familiarity by our administrative team in the implementation of this policy, unfortunately, because there are students who are truant.
A very small percentage of our school district. I mean, we're very fortunate we have kids who attend. As we talked about before, in terms of 93, 94% are regularly attending on any given day.
Yes.
But we do spend our time with Judge McGill at her court, and we do spend some time with children and youth when we need to.
Absolutely. And so I'm scrolling through this, but it's a long policy. It's an involved policy. And as you can see, as Damien mentioned, most of it is in bold because the language changed significantly several years ago. Any questions about this policy?
Okay. Great.
No.
Thank you. Oh. Did you say no, Mr. Needleman?
Yeah, no, I'm sorry. I just said no, just for the record. Thank you.
Sure. Dr. Yannicka, my next policy is 216, please. This is one of my favorite policies in that there was almost no changes proposed by the review from legal or from PSBA, other than making clear our definitions, which is just around school records and our process of what we will share, what we will not share, our directory information, and the way in which it is processed. So this really had very little change. It's really on the inside on our part, the administrative regulations, who does what and how we do that we'll work on this summer, but that's an internal, it doesn't change the policy, it's just the procedures internally of who does what. Any questions on 216? Okay. That brings us to 236. This is the policy for our school assistance program, student assistance program, excuse me. Student assistance program, we have talked about SAP, student assistance program, in the last few meetings here, but also broadly in academic affairs and at the board, in that we, since 2015, have had an active student assistance program here in our district. This just, the only actual change we did was to clarify what a student assistance program is. So you see that in bold, just to make sure that the focus of a SAP program is really around mental health and substance abuse. And that's the way the funding comes from Pennsylvania. And we have additional resources from the county to address that within our school district. As you remember, that we have a partnership with Aldersgate, our county agency to which we are tied is Aldersgate. That's who's assigned to us by the county. Any questions? Excellent.
No.
Dr. Yannicone, 251, please. So in true disclosure, the timing of this review was perfect because this one was up for us to look at, and PDE was in touch with us to do our cyclical monitoring of our homeless students program. And so in that time, we were getting some feedback that our old policy was missing some components, to which I was very happy to relay to our mentor and auditor who was visiting with us that we had a proposed draft plan. She took a look at our draft plan, and I, as far as I have heard so far, there is nothing she's recommending we change in addition to what's in there. So this really just clarifies the information that came out of ESSA, which ensures that students have access to educational stability, that they are not provided any barriers to registration if they identify as homeless. It clarifies that it's our obligation what the dispute process is. As a point of information to this board, excuse me, when a family discloses that they do not have housing stability or that they are homeless, we make the assumption that that is in good faith and we proceed accordingly. And then in the event we need to do any investigation or tracking, this policy provides a process for a best interest determination, meaning should they be with us or with the district of residence where they are currently residing? Like, how can we provide educational stability? How will we transport the child? And then in the event there's a dispute in this policy, there's a proposed action steps around the dispute and the rights families have throughout the process as we disclose that. As you may or may not be aware, we serve and in any given year anywhere between 3 to 15 students and families who identify as being homeless or having housing instability. And so we have a process. We have a coordinated regional consortium that's housed out of the Bucks County IU that provides us with guidance in the event we have questions or we're not quite sure. We reach out to our regional contacts and then to the state contact. And while I've been here for 7 years, we've only needed to do that process. We've only needed to take it that far to involve the state in a dispute resolution one time. Any questions for me about that? Dr. Yannicone, anything else you wanted me to mention that I overlooked? I'm moving between screens.
You didn't mention the training, but I think that it's outlined there fairly clearly.
And one of the things I reported to our auditor is this is where being a small school district is works to our advantage. As you know, we have social workers in every school building or counselors. We provide overview training of the rights of students who are experiencing housing instability and homelessness to all staff. But the reality is there's such a few number that we do follow-up specific training to those who are directly involved because we have such a few number of students and enough support personnel to make sure that on the ground level, the staff who are working with the child understand what that might mean to them and what their rights are. Anything else?
I think we can move to the next one.
Okie dokie, 255, 250, you added 253 back in, I believe.
Yes. So 253, I just wanted to point out, I believe that all the members of the committee are aware that Springfield Township School District was one of the very first districts to adopt and approve a policy for transgender and gender nonconforming youth. Our policy, therefore, was pretty tight relative to expectations at the state level. However, we did get a little bit of guidance at the end adding in just the statement regarding Title IX, that any complaints that come forward go through our Title IX coordinator. And at this time, I believe you're aware that's Emily Care. And so we have a whole complaint process that's to be followed in the event of any concerns in that area. But otherwise, the policy is remaining the same as it has been since its inception. Any questions about this policy?
No.
Okay. So I think, let me go into my agenda.
One more, 255 right below there, and then we're done.
Oh, thank you. Yes, thanks, Damian.
The last policy that I am responsible to bring forward to you is one that has been long in coming that we needed to get in here as a result of our requirements under ESSA. Something that Dr. Yannick knows I spend a lot of time on is providing services, educational stability for children in foster care. The homeless and McKinney-Vento components align here too. Children who are living in foster care or in supported housing for some reason or another through children and youth are entitled to educational stability. The concept of educational stability, as you all are well aware, is to make sure that we contain, to the extent we can, the amount of changes the child's experiencing on the outside of school in school. So where appropriate, either a child who has been attending Springfield Township but lives now in foster care outside of our township or county can maintain their enrollment in our school district during the time that they're in foster care. And conversely, the other happens also. Students who go somewhere else but move into Springfield Township in foster care can maintain their enrollment in another school district. And that process, again, is completed through a formal meeting called a best interest determination, otherwise known as a BID meeting. And that outlines sort of who's going to do what in partnership. It does require school districts to play nicely together. So in problem solving ways to ensure as few barriers as possible exist for a child or family. And so this just outlines all of that. I will say beyond the scope of this particular committee, there are implications in terms of transportation, in that we sometimes are picking up transportation costs and sharing those costs with the school district where the child is residing or where they're attending, and who initiates what and how we negotiate that has added some extra expenditures because especially with our role with Carson Valley Children's Aid in our township, we are responsible under this same process to provide that support and services beyond the children in our own 4 buildings at Carson Valley as well. So these two things actually play out regularly here in our offices. Any questions for me about educational stability for children in foster care? The new policy we're adding, policy 255. Dr. Yannick, and that completes my presentation this morning.
Okay, thank you very much.
Thank
So
you.
I'm gonna stop share for just a minute, and I want to point out a few items that are not on the agenda. So I'll reshare. I just wanted to move in and out of screens. So with these policies, we have concluded the 200 level policies that we wanted to bring forward this spring. It's our intention over the summer and fall to finish the 200s with this list of policies. So several of these policies we want to take more time with. And so we're going to do that in the summertime with our team and when Dr. Lutz is on board. But then you also notice there are 4 policies that are saying pending a PNN update. We are waiting for legal guidance. The entire state is waiting for legal guidance. So it would not be wise of us to revise and then have to revise again, knowing that there's legal guidance coming. So I wanted, just in case any questions arise about why didn't we address this or that policy, it's because we were waiting for some legal updates. And then in addition, as I think we mentioned at a previous meeting, 236.1, the threat assessment policy is very involved. And so we're waiting for Dr. Lutz to come on board so we can take a look at that with her before we'll bring that forward. Okay, so these will be the last 200 policies that'll go on the agenda. Thank you, Sarah, for your recognition of Dr. Johnson. She's done a great job. If I go back to the board agenda, you're going to see the same document that I have here in my spreadsheet. I've asked Luann McKenna, my administrative assistant, and this is under administrative content, to create a spreadsheet that you have ready access to. And I'll just bring that up. Because we're doing so much board policy revision, I wanted you to have a place where you could look easily at when are we doing first reading, second reading, has the policy become active yet? And that AR is administrative regulations. It's our intention as an administrative team for any policy this summer that has been board approved, if there is an administrative regulation, we will revise it to fit the policy, any changes that have come across in the policy, and then we're actually going to create an administrative regulation manual. So most districts do not list their ARs on their website. They actually have them as a separate document that administrators review, and that's sort of the procedures that administrators go through when implementing that policy. So you're going to see those ARs begin to be completed over the course of the summer. There's a tab for each level. So here are all the 100s. And when we've done readings, and Luann will add in the status as these start to then get finalized as active, meaning they are in board docs and active. I'll get there in a minute. And so here we are with the 200s, and you can see she has left items in bold that we will be waiting on, and then all the other policies will have approved by the end of this month, in theory. And then we'll work our way through. We have the 300s coming next, okay? So if I go, I'm gonna stop share for a minute again. Excuse me 1 second, it's asking me to verify my password because our cybersecurity has tightened up. But if I go into, I wanted to show you all on the website. Can you see the web page now? I'm going to bring it up. So we've added this statement under board policies to share with the public that we are in the process of renewing our policies. And as a result, they're going to see some policies in board docs, the public site, and some policies continuing to be on our website. As we complete a section, like we're going to finish the 100s tomorrow night, they will shift out of the website here and into board docs. So now, if a community member goes to board docs, the public site, and they select policies, and they select active policies, they're going to see the zeros now fully visible on the website through that site. We'll add the 100s after tomorrow's meeting, and then we'll add the 200s later this month. And the idea there is that we'll continue to shift the community over to board docs. Are there any questions about that?
I think that's a great idea. Increases transparency.
That was our hope, that it'll be really clear and easy for the community to see where policies sit. And then for the members of the committee and all the members of the board, if you go into that administrative content, you'll be able to see that spreadsheet. And we'll share that with all of you when we complete it. So if there's a question 2 years from now, when did we approve that policy last? It'll be really clear in the spreadsheet. Okay. So the next round of policies that we're going to be looking at are the 300s, and they are staff focused. So Emily Kerr will be working with me on that round of policies because the 300s are very specifically elements of staff and community relations. And then we'll move into, there's no 400s or 500s. I know it seems strange, but we skipped to the 600s. So we'll move into 6, 7, and 8s, hopefully by May. So the goal is we'll do the 3s in April, and then move on to the 6s and 7s in May, and the 8s and 9s in June. So our goal is still to be finished the policy review by the end of the year, provided you're still available for us on a fairly regular basis to be having these check-in meetings. Is this working for you? I just want to check again, because I know we talked about later in the day or 8:30? 8:30 is still working for everybody? Okay, all right.
Yes.
So I'll let you know when the next, I'll send an email about the next policy meeting, but I think it will not be likely until just after spring break. I think we're thinking we'll take a little bit of a breather, and then we'll come back together just after spring break to have the 300 level policy meeting. But I'll confirm that with Emily Kerr. I want to make sure that she has time to review them all. And I want to make sure that our solicitor reviews every single 300 level policy, because they all have staff implications. Okay. So that's our entire agenda. Dr. Johnson's been keeping notes that she will share. And so she'll share them with the four of you. And I just need to know, we did not put a name attached to the policy report tomorrow night, because we didn't know whether Carla wanted to continue in her tenure or one of the rest of you wanted to pick that up. But Damien will send them to all four of you so that you have the notes.
Dr. Yannicone, I'll volunteer unless Ms. Green wants to do it. If she wants to do it, by all means. Otherwise, I'll volunteer to do it unless somebody else wants to.
Michael, you go ahead and do it, but I did want to add, well, whoever does it, just like Dr. Yannicone, you went through where the parents can access that movement. If someone would just go through that, that would be really, really great.
Yeah.
Because we have those, I can't find it. I don't know how to do it, you know. And actually week to week, I can't find it. So
Would you like me to include that in my administrative report?
I think that's a great idea.
Really
Okay.
great.
I'll be happy to do that, because I'm planning to share some photos. So I'm gonna already have the website up.
Okay.
So it's no problem at all. I'll do that as part of my administrative report. That'll take it off your plate. All right.
Dr.
Great,
Yannicone,
thank you.
I did include that in our minutes as well, so that will be documented for the community as well.
That's great. Thank you.
Thank you.
Thank you.
And I'm just going to double. Oh, I'm sorry. Sorry. Yes.
Oh, no, I had a question, but please continue your thoughts and then I'll.
Oh, I was just going to double check with our tech support that we don't have any community members who've joined us.
No attendees.
Okay, I just want to double check that for public comment. So sorry about that, Sarah. What was your
Oh,
question?
no worries. My question is just this review process. What is the cadence? Like, will the next time that a comprehensive review like this be in 5 years? Like, I'm just curious, like, what the pacing is of the next time there'll be this kind of deep dive in the policies, because I know this time was a very wide gap since the last time.
Yes, it was 10 years. It's been 10 years. Well, keep in mind that there are legal updates that come on a monthly basis. So in theory, once we go through the full review, if each month we respond to any legal updates with recommended changes in policy guidance, we will stay up to date. You won't need this comprehensive a review. We knew that we had let this area go for a little while, as far as making sure, in particular in the second half of the policies. There are regular updates in the 200s and even the 300s, because law changes fairly frequently in those areas. But in the 6s, 7s, 8s, and 9s, there are fewer legal changes, typically. Policy 903, you'll recall, we had an executive session, and then we updated that policy because there was a legal update. So in theory, you'll be able to, on a regular basis, be up to date, because PSBA provides these legal updates. So I'm hoping we won't need another overwhelming comprehensive review, because obviously this is a lot of time for our review, a lot of time for our administrative team, and a large undertaking, because every policy that has an administrative regulation, once that policy is approved, we now need to go back in and make those changes in multiple locations, not only on the website, but in our student code of conduct, in our staff manuals, etc. So I'm hopeful that you will not need to do this again in the relatively near future.
That was very helpful context. Thank you so much.
Absolutely, no problem. Any other questions or policies that you're concerned about right now that you'd like us to make sure we expedite?
I just want to say, in the beginning of the year, is it the procedure, Damien, that your EpiPen training, your diabetes training, and all that staff training takes place in the in-service days at the beginning of the year?
It does, and we do that on an online portal system.
Okay.
We get you take a quiz at the end, and then it gets documented in your log. So we have a reference of anyone who did not complete it so that we can do any follow-up. And the EpiPen we allow staff to do that in advance prior to the 4 days if they choose to.
Okay.
They have additional prep time. It's their choice to do it ahead of time if they like, but then they do a demonstration of their EpiPen proficiency with each of the school nurses in each of the buildings during those 4 days of school.
All right,
Every
thank
year.
you.
Mhm.
Okay. So I'm going to send an email with regard to dates in April that you might be available for us to look at the 300s, but we won't, it won't be in 2 weeks. I just want to make sure you know, it won't be the week of the 28th of March. So it'll be the following month that we'll be looking for, potentially the first week in April. Before spring break, if Emily feels we can be ready. And I want to make sure that PSBA and our solicitors had a chance to fully review each of those policies. It's a shorter list. The 300s are a shorter list, but they are significant for us to make sure we're on track. Okay.
Dr. Yannico and I did share those minutes, the draft of those minutes with the committee and yourself, and obviously Mrs. McKenna as well. So if there's any, please let me know. I'm happy to make any changes if I missed something or overlooked something.
That's great. I appreciate that. So all the policies that were on today's agenda will go on tomorrow night's board meeting because we're still well beyond 24 hours prior to the meeting. So you're going to see a change in the board agenda where we're going to add the first reading of this group of policies tomorrow night to the second reads we already have in place. Okay?
Thank you.
You got it. All right, everybody. We'll see you tomorrow night. Thanks so much.
Have a
Great,
great day,
thank
everyone.
you.
Have a great day.
Thank you.